This ecosystem within the North West Coast, which has been going now for just over a year, is connected to lots of other ecosystems internationally. The European Connected Health Alliance is there really to support that network, to enable you and the other ecosystems to learn and share from each other, and to also give you a platform to share your learning and get you market access, if you're in industry, into these other ecosystems. So currently this is what our ecosystem network looks like. So on this side here we've got the existing ecosystems, of which North West Coast is one of them. We also have your neighbours Greater Manchester, who've been going for about 2.5 years now. Estonia, Oulu in Finland, Greece, who are quite rightly at the moment just having a pause while they go through their challenges. Northern Ireland, Republic of Ireland, which is our newest ecosystem, they had their launch meeting on the 29th of June. Scotland, and we also have one in New York. Now you can see there that we've got a further 9 that are at pre-launch or relaunch, and those ones will all be having an ecosystem meeting just like this between the months of September and November. And then we're having some early conversations with a further 15. Now the idea really of showing you that is really for you to see what you're connected to as an ecosystem and what expertise and networks you're able to access by being part of this ecosystem. So each one of those ecosystems will have a meeting like this once a quarter, which means that there's over 100 meetings every year, and we make sure that somebody from the European Connected Health Alliance goes to every one of those meetings so that we can collate and understand what people's priorities are and then connect you up with the best people. Now for our members, and I know that a lot of you are already members of the European Connected Health Alliance, it's free for you to access any of those ecosystem meetings and get support from us. If you want more information about that, just get in touch with me. I am here all morning. So as the European Connected Health Alliance, what we do is we try and understand and map what each ecosystem priorities are. And the reason we do that is because we really want to invest our resources and your resources across that network to better enable you to get some learning. We do that in a number of different ways. One of the ways we do that is to have cross-cutting theme groups, and we've got 2 cross-cutting theme groups. One which looks at e-health strategies, and what we do with the e-health strategy group is we are interested in people coming to that group who've got a regional leadership position, who also have the opportunity to link into connected health delivery, and we pull together the best of e-health strategies that are currently out there. What does a good e-health strategy look like, and what are the good and the best in class delivery mechanisms and models to do that? And then we share that out across the network. The other cross-cutting theme group that we're focusing on at the moment is medicines optimisation, and I know that that's a key theme for the North West Coast. And as Julia leads on alcohol, you've got a programme manager leading on that as well. And that's very early in its stages of launch, but what we're hoping to do with that through Professor Mike Scott, who's working with us as chair of that group, is to understand where people have achieved best practice by looking at innovation to achieve better medicines optimisation, and then share that out quickly amongst the network and to you all. We also have other ways of supporting the ecosystems. So we have regular calls and meetings which are bespoke to each ecosystem, and we also attend working groups to talk about what those delivery mechanisms for the work looks like. We have 6 weekly networking calls for the ecosystem coordinators and leads to enable them to understand what's happening across the other ecosystems, and as I've mentioned, we also have the cross-cutting theme groups. The other thing that ECH Alliance does is gives you the opportunity to partner up with international partners for bidding purposes. And yesterday I was talking to Julia about the theme of alcohol avoidance, and we were discussing an EU bid that's out at the moment that I just wanted to make you aware of. So there's a bid out at the moment via the Third Health programme, and it's called Gathering Knowledge and Exchanging Best Practices on Reducing Availability of Alcoholic Beverages. So that's really specific to you all who've got an interest in this area, and it has got specific content relating to young people. Now, this programme is interested in finding people who want to bid for that money, and that money is €9 million, so it's quite a significant pot of money. And when I was talking to Julia yesterday, Julia was saying that she was really interested in anybody who was interested in going for that bid, and what the North West Coast would be able to do is support you with that bidding application and support you in developing that bid, taking you through that process. And they've already got quite a lot of experience in delivering and going for EU bids. So it's a really good resource. So anybody that's interested, get in touch with Julia. And as the European Connected Health Alliance, we'd be more than happy to try and find you international partners to partner up to take that bid forward. So I'm sure that the link will go out with the slides. Yeah, we'll send the link out to that, and then you can read a little bit more about it. Okay, so the last thing I just wanted to mention is the European Connected Health Alliance has expanded further, and we now have a China Connected Health Alliance and it's actually Connected Health Alliance Canada. Otherwise, we'd have two CCH alliances. What these alliances do for this network, for the ECH Alliance, is it gives us opportunities to find out about markets and best practice in other countries. So at the minute, the European Connected Health Alliance has got a health mission in China, and a couple of people from this ecosystem are actually there now looking for those market opportunities and learning to bring back to you, and I'm sure that will happen through one of these meetings. The Canadian Connected Health Alliance is just ready to launch, and they're just going through the process of setting themselves up at the moment. So if anybody's interested in getting involved either at European level or more globally, come and talk to us, and we can talk about what that looks like for you. So I'm now going to hand over to Julia. Yeah. Is it Julia? Okay then. So thank you very much. If you do want to get in touch, they're the key contacts for the European Connected Health Alliance. My email address is there. Thank you very much for listening.
Thank you. Thank you, Liz.